Hey guys, one major category of health problems that can be helped through chiropractic care are problems with extremities, shoulder problems, knee problems, ankle problems, just to name a few. In this video, we'll talk about how chiropractic can help with extremity problems and when you should go see a chiropractor if you're dealing with one of these issues. Many people are surprised that chiropractic can help with extremity problems. I mentioned in my first video, one of my favorite things is when someone comes to see me and they end up getting help with a problem that they didn't even tell me about. And I'll be checking someone's spine and they'll mention, yeah, I just got an MRI in my knee, and be like, well, what's going on with your knee? And they'll say, well, I've been dealing with a problem for years, been through physical therapy, which helps some, but I'm still dealing with the issue. And so I will ask them if we can check it. We check the knee, find a misalignment, and correct the misalignment through an adjustment. And they will give me what I call the deer in the headlights look, saying, are you serious? I've been dealing with this issue for years, and that was the problem? You see, if there's a misalignment problem with a joint, it just won't function properly and it won't heal properly. But people ask me, well, what about physical therapy? Isn't that helpful for joint issues? And absolutely. But if a joint isn't properly aligned with the proper motion, physical therapy just won't be as effective. Chiropractic and physical therapy could actually work really well together, with chiropractic restoring the proper motion to the joint and then PT working with strengthening the muscles and the tissues around the joint to help with the healing. So, how does a chiropractor determine a joint alignment problem with an extremity? Primarily is through motion palpation, which is determining the abnormal motion of a joint. Take, for example, the ankle. Specifically the joint between the tibia and the talus, which is basically the main joint that connects your leg to your foot. This is a super common joint to be subluxated. Okay, you may be wondering, what's subluxated? Well, so up to this point in my videos, I have used the term misalignment to refer to what chiropractors correct. But it is actually more complex than that. The more correct term is subluxation, which is a subtle misalignment of a joint that involves abnormal movement. More specifically, hypomobility or fixation, in other words, stuck, which also causes nerve interference and affects joint function. I'm going to devote an entire video to the subject, but I needed to address it here because one of the key components of a subluxated joint that I use to evaluate extremity problems is abnormal motion. Okay, so back to our ankle. The tibia talus joint is the main hinge joint of the ankle that allows your foot to flex back and forth, which is crucial for normal foot function. This joint can get subluxated or stuck, so it loses its normal motion. Based on feeling exactly where the fixation is, a chiropractor can help restore normal motion through an adjustment. So what causes a subluxated ankle? Well, a common cause is an ankle sprain, but often can be micro traumas that happen over time that you don't even realize that you have. This is super common in athletes. Now, this is just one example of an extremity joint that can be subluxated that can be helped through chiropractic care. What other extremities can chiropractors help with? Well, if it's a joint, we can work with it, whether it be shoulders, elbows, wrists, fingers, hips, knees, ankles, toes, or TMJ. I will cover some of these in other videos. But one question I get is, how do you know when to see a chiropractor for an extremity problem? In the case of an injury, if there is any question at all of fracture or ligament damage, definitely go to orthopedic urgent care to have it evaluated. If everything is cleared of structural damage, then a joint can definitely be checked for subluxation by a chiropractor. And if a joint is subluxated, the sooner that subluxation is corrected, the better, as it'll give a chance for it to heal properly. That being said, is it ever too late to have an extremity checked for subluxation? The answer would be no. I've had patients tell me about problems they've had with an extremity for years or even for decades that we've been able to help them with. No matter what the situation, a joint will function better if it's moving properly and in alignment. Another question I get is, do you need to adjust it more than once, or does it take multiple adjustments to correct the problem? And there are a lot of factors that are involved with that question. How long has the problem been there? What is the severity of the subluxation? In the case after an injury, what are the condition of the tissues surrounding the joint. You see, we're not just dealing with the restoration of the abnormal motion and the misalignment in the joint, but the tissues of the joint surrounding the joint need to heal as well. In the case where the subluxation has been there a long time, multiple adjustments can be needed not only to correct the alignment in the joint, but also allow the tissues surrounding the joint to heal. Now let me ask you this. If the alignment of your car is off, does it make sense to get it corrected right away or wait until your tires wear unevenly? Kind of a rhetorical question. So if the alignment is off on your knee, does it make sense to get it corrected right away or wait until you develop knee problems? Again, kind of a rhetorical question. Just like bad alignment in your car affects the performance of your vehicle and wears out your tires faster, bad alignment of your joints affects the performance of the body and causes your joints to wear out faster. This is why many of my patients choose chiropractic care on a regular basis, to make sure that their joints are functioning at their optimum and so that they can perform at their best, instead of waiting for problems to develop. Now, the other thing with extremity problems is that the issue may not be from the extremity itself. What do I mean by that? Well, I find this super common with shoulders, for example, whether it be shoulder pain or limited range of motion or both. I find that there is nothing structurally wrong with the shoulder. It's not subluxated. How do I know that? Well, I check the shoulders and find that one or both shoulders have limited range of motion, but I have learned that shoulders are affected by subluxations elsewhere in the body, whether it be in the spine or the pelvis. So I will check for and correct subluxations in the spine or the pelvis first, and then recheck the shoulders and find that the problem has been corrected without having to adjust the shoulders themselves. That's what makes chiropractic so cool. It actually looks for the root of the problem and then works with the body to help make the correction. So awesome. So if you know someone who has an extremity problem, whether it be a shoulder, a knee, or an ankle, or any other joint, I invite you to like and share this video with them so they can find out how they can be helped. I also invite you to subscribe to this channel so you can find out more about how chiropractic can help you and the ones you love. Thank you so much for watching, and I'll see you next time.